Now, around a year ago, there were signs of the pandemic that was set to shake the world. Governments and health specialists are still grappling with how to communicate and make the message stick, how to make people understand that they are vulnerable and that they can save others by wearing a mask and maintaining physical distance. Let's look at how South Africa has fared and the role of COVID Comms. Now, COVID Comms is a volunteer network of communication professionals that was galvanized into action by the need for clear public service messaging. The convener, Vick, was part of a communications team advising the president in the initial months of the lockdown. He joins us now via Zoom. Welcome to you, Chris. Tell us a bit firstly about COVID Comms. Were you called upon, for example, to advise the president, or was this about a group of professionals saying, pick us, we'll help out for free?
It was a completely voluntary initiative, Francis, and thanks for the opportunity to talk about it. I put out a tweet in March after the lockdown was announced because of a concern that the way government was communicating was very formal, very official, and very English. And what happened after that was a very large group of people, about 170 people initially, volunteered to help. And essentially the mission was to take what government was saying and to package it in ways that people could relate to. So we've used a lot of infographics. Almost everything we do is translated into all South African languages. And we've built some distribution networks which go far beyond what government has been able to do. So it's not a government initiative. It's very much a civil society initiative. We're a non-profit organization. But our aim is to support government and the people of South Africa in understanding the threat of COVID-19 and what we can do to protect ourselves against the threat. So it ranges from advice on how to sanitize, why it's important to wear a face mask, but also sort of more broader societal problems such as psychological issues, people who are depressed by the lockdown, people who are suffering from gender-based violence. So it's a very broad scope of work, but it's really just to try and get the message across of how to stay alive in summer and beyond.
And without the budget of a government department or a private company, how do you get those messages out there?
Well, it's been amazing to see the way in which people have stepped up. Part of the phenomenon of the lockdown was that some of the communications professionals were unemployed, people who do freelance filmmaking, for example, people who do translation work. And what they've done over the last 9 months is work entirely without payment. There's a little bit of money that we used initially, but everybody at the moment is working on a completely voluntary basis because they see the importance of communication around behavioral change in particular. So this is not news alerts about what COVID is doing or about the lockdown. This is primary information, primary healthcare information around how to stay alive, as I said earlier, and how to sort of manage your way through the various elements of this pandemic.
You're still saying there's a need for simple messaging, especially in vernacular languages. I did see the other day an animated video, very simple, from, I think, the health department, talking about the symptoms of COVID-19. Quick, short, sharp, but you believe there's not enough of that going around?
Well, if you think about it, we're 9 months into the pandemic, so we've lost a lot of time in terms of communication. I think as the second wave arrived, as the surge started to hit home, there's been a lot more communication than there was in the beginning. But our primary concern remains two issues. One, a lot of the information is in English, and I think that's biased. I think we need to make sure that we provide for people who don't speak English. The second is distribution. Not everyone has access to the sort of information that's being produced. And it's particularly challenging during the pandemic because you can't do the sort of thing we did in the 80s where you distribute pamphlets and you have door-to-door meetings. So we're using platforms like WhatsApp in particular to get our information out to people. But to be honest, the more we can do, the better. I mean, I still see people who don't wear face masks. I still see people who don't understand the importance of social distancing and hand washing. So the more work there's being done around this, the better. Yeah. And COVID Comms is very much about complementing what the Department of Health in particular is doing and some of the other initiatives that we've seen, because we seriously believe we've got some skills, we want to use those skills in a particular way, and if we can save one life, then it's worth the effort.
Yeah, well, good for you and the other professionals involved. Something I'm seeing on the way home, I take a highway home, these huge billboards saying don't be a mampara, for example, wear a mask, don't be a chop, social distance. I think that's the Solidarity Fund campaign, which does have sponsored funds. Why are you critical of that campaign?
Well, the COVID comms team, I mean, we spent a bit of time assessing that work. It doesn't resonate. If I look at the reaction on social media, which is not an ideal world, but it indicates one set of opinions, none of that material is getting promoted. None of it is moving into communities and making an impact. But I think there's a deeper question, and it relates to a piece that Tessa Dorms and I wrote on News 24 this week, that in a sense, calling people out for being idiots or mamparas is not the way to instill behavioral change. We need to encourage people to do the right thing. I mean, I've seen some of the Solidarity Fund social media interaction where they pick up on a photograph of someone who's not wearing a face mask and call them a mampara. I don't think that's going to make them wear a face mask next time. I think we need to explain to that person why it's important to do it, the threat that they pose to themselves and other people. So we should be using the lessons from the HIV/AIDS pandemic, for example, where a lot of effort went into encouraging positive behavior and not focusing on negative behavior. Because that, in my view, and in the view of the COVID comms team, is how you begin to bring about positive change. You encourage people, you don't condemn them. And I say that knowing full well that the lockdown in itself is very restrictive and it's about enforcement. We need enforcement. We need to encourage people. We need to have positive messages that say to people, look, it's really important that you do this sort of thing. It's really important that you think and make conscious decisions about where you go and who you interact with and how you interact with those people, whether you social distance, rather than naming and shaming, which I don't think is particularly effective right now.
Chris, before we let you go, will you give me your quick assessment of how government's doing right now? I mean, throughout the year, there's been a lot of criticism. The president himself said there were contradictions. I think the worst mistake may be him saying that smokers could smoke again, and then that was overturned. And also criticism that he was talking to people in an adult way, respectful that their democratic rights were being taken away, maybe for good reason here. But then some of the ministers were talking down to South Africans. How do you think government is doing right now?
Well, I don't want to get into a critique of how government has communicated, except to say that it's been late and it hasn't communicated sufficiently in South African languages. But I think the key thing is that we're all doing the best that we can. And the reason that we posted an article earlier this week calling for a meeting of minds is we seriously believe the best way to beat this pandemic and to get real behavioral change is for government, civil society, the people with the big money like the Solidarity Fund, to put our heads together. And Francis, it's particularly important as we enter the vaccine phase, because already in terms of COVID-19, there's been far too much false information. We cannot go into a phase where vaccines are essential to save lives and prevent the spread of the pandemic without a concerted effort that deals with the crazy people who think vaccine has pig blood in it or vaccines will give you a rash or a headache. We really need some honest information as we enter the next phase, if and how we survive phase 2, the current surge in the pandemic. We've really got to get our heads together around how we deal with the anti-vax campaigners and get people to understand why a vaccine is important, not in isolation. We still have to implement preventative measures, but we've got to get people to embrace the idea that the vaccination campaign is a key element of making sure that this doesn't spread even broader than it can. So our view, we're prepared to work with anyone. We're prepared to put our heads together with the SABC, who's got a massive reach, with government, with other entities, because we're all learning lessons along the way. We've learned lessons about the importance of shock tactics, which we weren't sure were going to work, but some of our shock tactics material has got a very good response. Addressing people as adults, engaging with them, convincing them and encouraging them to take care of themselves is an effective lesson, and we're very keen to share our ideas around how we can make an even bigger impact on society and really stop this thing in its tracks.
All right, well, we wish you even more success. You're right, the big job now, changing perceptions around vaccinations. Thank you so much for your time tonight, the convener of COVID Comms, Vick.